Now moving on, the government has reported a mass failure in English language by health workers seeking employment in the United Kingdom in a pact between Kenya and United Kingdom government. Addressing the Kenya Clinical Officers Association conference in Mombasa County, Health Cabinet Secretary Kagwe said only 10 out of 300 healthcare professionals who sat the English examination passed the test.
Health Cabinet Secretary Kagwe was speaking at the Clinical Officers Conference in Mombasa, termed it regrettable that the majority of health workers who had been shortlisted to go and work in the United Kingdom could not pass English proficiency test examination, which was a mandatory requirement.
Let's set the standards so that we are sure that there is no exam anywhere on earth that a clinical officer trained in Kenya can fail. This is an issue. And therefore, when we talk about technologies, when we talk about the future, we need to prepare ourselves to be in that space. And the only way to do it is for us to appreciate our strengths, yes, but we also need to appreciate our weaknesses so that we can address those weaknesses at the appropriate time. And the appropriate time is now.
Kagwe said there are negotiations going on in the Middle East and Europe to have more health workers exported, but challenging the health workers to ensure they have the universal standards of training before they go to the respective countries.
We as a government must create capacity in both infrastructure and resource, and we must increase the number of officers that we have, clinical officers that we have, in keeping in tune with the population. What I am going to challenge and what the policy we would like to lay as a government is that every year, in the same manner as we recruit soldiers every year and we recruit police every year, we also want to increase the health workforce in the same manner.
He added that the ministry is going to ensure that the curriculum is upgraded and encompass information technology, as hospitals and clinics will soon become paperless, to ensure effective delivery of health service.
That the quality of service that we provide must be at the highest standard possible, equal to anywhere on earth. If you do that, it will be possible. And given the expansion that we have had in the health sector over the last 1 year, it will be possible for us to make Kenya a health tourism destination. And if that happens, you will benefit.
The clinical officers are also demanding to be considered for job opportunities abroad like their peers. They are also calling for the posting of clinical officers interns as soon as possible to broaden their skills. For Primetime Edition from Mombasa County, I'm Michael Mondiga.